So again, my name is Dr. Vanessa Slots. I am the American Academy of Pediatrics Nevada chapter president and a general pediatrician. And I am really excited to bring this information forward to you guys today. I have no financial or disclosures to provide today, and I don't intend to discuss any unapproved commercial products or devices in our presentation today. So with our objectives in our first talk today, we are going to try to do two talks today. The first is to understand how COVID-19 is transmitted and understand the rationale for infection control practices around COVID-19. And so again, with Project Firstline, this came forward through the CDC National Healthcare Workforce as an IPC training collaborative. We really are aiming to provide foundational and practical knowledge directly to all frontline healthcare workers and targeted components of the public healthcare workforce. There are multiple Project Firstline talks, as well as different training opportunities that you guys can be involved with if you guys are interested in learning more about Project Firstline. And so we're going to talk predominantly around the coronavirus disease of 2019. I think most of us are pretty familiar with a lot of this information, but really want to just make sure that your foundation is nice and strong as we are continuing to work through this pandemic. So the epidemiology of the SARS-CoV-2 indicates that most infections are going to be spread through close interactions with infectious individuals. And so being at least within about 6 feet of or in poorly ventilated space with an infected individual for any extended period of time is certainly going to increase the risk of transmission of this virus. Now, this can happen both with asymptomatic or pre-symptomatic carriers. So we know that COVID-19 can spread before an infected individual shows symptoms, so being pre-symptomatic, or even if they are never showing any symptoms at all, meaning they are asymptomatic. And so COVID-19 is going to spread from person to person through those respiratory secretions. So coughs, sneezes, talks, that is going to potentially produce respiratory secretions that could land in eyes, nose, or mouths of people nearby, and then inhaled into the lungs, causing disease in those individuals. So we talked about poorly ventilated spaces being an issue. And so one of the biggest things through Project Firstline is to optimize indoor air quality. Since COVID-19 is more likely to spread in those environments where individuals are close together and in spaces that are poorly ventilated, we need to ensure that HVAC systems are optimized and recently inspected. There are standards for air exchanges in clinical spaces that is available on the cdc.gov website. And this is one of the biggest things that has been talked about and done in a lot of our school systems, especially known about here in Nevada, but I'm sure across the United States. A lot of businesses have also really done a lot more to try to optimize their system so that air exchanges are going to be much better. The other piece is minimizing proximity to others. And so really making sure that care processes do not require people to be close together except when clinically necessary. So I think a lot of offices have really looked at looking at their kind of waiting area layouts, how those processes look. Are people checking in and maybe waiting in their car? Are they directly roomed? Things like that in order to avoid congregation of people, especially if they may be sick. Another piece of this is really avoiding aerosol generating procedures. many of us don't necessarily consider like albuterol nebulizers as an aerosol generating procedure. That's probably the most common one that we're going to be seeing in the offices as well as in the school nurse office. And so making sure that procedures that are likely to produce aerosols, that they are done in a closed room and with only essential staff present. You don't want necessarily your MA present as well as the physician or the nurse or the MP to all be in the room at the same time when this is happening. So if only the provider that is giving that nebulizer can be present, that's going to be best. And then also having that room shut off and appropriately cleaned after is going to be really important. If you're in the hospital setting, then we want those procedures to be performed in airborne isolation. So in those negative pressure rooms as much as possible, so that we can decrease that risk of transmission to other people that might be in proximity to those patients. So infection control practices are critical tools to protect people from infectious disease, and that includes COVID-19. Preventing exposures is especially important as we are continuing to vaccinate our populations and as specific treatments are still being developed. And so each component really builds on the next and has to be used together. So looking at source control, visitor exclusion, potential for screening and triage practices, environmental and hand hygiene behaviors, and appropriate use of personal protective equipment. And so with source control, these should be practiced by everyone in the healthcare facility. I know new guidelines have just come out with masking, and if you are fully vaccinated, you may not have to wear a mask, but that does not include healthcare facilities. So everyone still should be masked in and around these places. So wearing a mask that covers both your nose and your mouth anytime you might be near other people, even if you're not necessarily in patient care areas. And this is one area where we have seen outbreaks happening at healthcare facilities, at schools, at offices, is that in the break rooms, people congregate without their masks on, and they could be spreading illness. Cloth masks need to be worn by patients and visitors, or we can also provide them surgical masks as they're coming in if they do not have appropriate masks to wear. Healthcare personnel are encouraged to wear surgical masks while at work and then switch to an N95 if you're caring for a known or suspected COVID-19 patient. So the next piece of this is really triage and screening. And so part of this is really instructing patients before they're coming in what their options are. And so telehealth has become a really viable option in a lot of practices these days in order to be able to be seen for appropriate things over telehealth. And if they are going to be coming in person, what should they expect? Are they going to call and check in from their car and you're going to come out and screen them? Are they going to stop at the front door? Are they going to be able to come in and be screened by the front desk? So just giving them some of those preparations before they even arrive. Also, we want to give some requirements if they are having symptoms or potential exposures, that we are aware of that so that we can be prepared for their arrival and make sure that they're wearing masks at all times. If your practice is allowing visitors to come with them or family members to come with them, again, alerting them before they show up if that's 1, 2, 3 visitors are allowed to come, or if none are allowed to come with them. So again, making sure that all of that is prepped before they arrive. We want to make sure we provide supplies for respiratory hygiene and cough etiquette, so sanitizer, tissues, trash receptacles, masks if they don't have them, and then really limiting and monitoring points of entry. So while a lot of people now are being vaccinated and there are facilities that are opening up a little bit more, we still want to make sure that we have the ability to kind of screen and make sure we know who's coming in and out. And then prevent crowding of patients in shared areas. So we already kind of discussed this, but limiting the number of individuals in that waiting area, whether that's direct rooming, having them wait in their cars until they're ready to call for their turn, or whatever that workflow works best for you. And then the other thing, again, is screening your patients, visitors, and staff if they happen to have any symptoms consistent with COVID-19 or exposures to anybody who has SARS-CoV-2. So with personal protective equipment, or PPE, a lot of how well PPE works depends on you. So making sure that you're using the right PPE for the right way and the right time, making sure that you've been properly fitted for your N95 and that it is in proper working order. And so really what we want to make sure that you just have available is that N95 respirator, which is going to filter out particles in the air so they're not inhaled. And it also just provides a barrier against any splashes that may be happening. And also for you, breathing out potentially infectious particles if you are asymptomatic. Eye protection is really important. Again, block splashes that may land in the eyes. These should be over your natural glasses. Your glasses do not count as eye protection. And if you can use reusable eye protection that can be cleaned and disinfected between patients. Gowns are going to also protect clothes from contact with soiled surfaces, and also can just make sure that those infectious particles are easier to remove, as are gloves. And then making sure that you're using your hand hygiene both before and immediately after glove use. And so the nice thing with the SARS-CoV-2 is that it belongs to a family of viruses that are inactivated by standard hospital disinfectants and detergents. So nothing special has to be done in order to kill off the SARS-CoV-2 virus. It has a lipid envelope, which is just a fat-based external layer, and detergents and chemicals like bleach and alcohol are going to disrupt that outer layer and then damage the virus, and not which will allow it to not cause infection. So routine practices for hand hygiene and cleaning are just going to be really important, as they are highly effective against SARS-CoV-2. With our hand hygiene, again, this can be alcohol-based hand sanitizer or washing your hands with soap and water. Either way are going to clean your hands appropriately and prevent delivering infectious materials from the environment or your patients into your eyes, nose, or mouth, where the respiratory viruses can cause infection. And again, just to highlight that the SARS-CoV-2 that causes COVID-19, again, is inactivated by soap and water and alcohol-based hand sanitizers. So either way is totally fine and just needs to be used before and after any contact. So in closing with our first talk, rigorous infection control is crucial for protecting our healthcare workforce. We've been dealing with this now for about a month, and really I think a lot of places have stepped up their infection control, but it's going to be important that we continue that so that we're continuing to support the end of this pandemic. There are, again, other sessions that are available for Project Firstline around PPE, triaging, IPC guidance, communicating risk. And so you can actually go to the CDC Project Firstline site in order to look at more information around this great program. A lot of people may be aware that the American Academy of Pediatrics has a lot of COVID-19 guidance and resource available. They're doing town halls regularly. They've got practice management tips. While we are out of the flu season right now, the new one will be coming forward and may look a little bit different, as this last one did as well. The CDC, again, has lots of standard precautions. It has information about the air quality control if you want more information on that. And again, Project Firstline. So we're going to take a few minutes and see if anybody might have any questions about our first topic before we move into our second. Yes, Laurie.
Just to clarify, I doubt anything special, it sounds like, but I've been avoiding nebulizers. Of course, no one's been getting sick. Strategy I've been using is if they have a known med prescription, they just give it before arrival. I know we're going to have ones that come in that just need treatment. So you did very well on how we clean, most of the standard cleaners are doing well. We keep a closed room. So in an office setting like mine, little private practice, let's say I nebulize a kid, is there like a length of time as well of leaving the room not used for a while, or any other criteria we need for aerosolized, treatment like that?
Yeah, so I did look up some resources for that. People were really showing anywhere between about 1 and 2 hours of leaving the room closed, and then just making sure that you're going in with those appropriate disinfectants after. And mainly it's just to kind of let the air settle for your staff. And I would have them wearing, even though at that point it shouldn't be an issue, but making sure that your staff is going in after with N95s on and everything to make sure that just in case there's any particles still present, that they're not going to pick that up, and then just using your standard cleaner. Other questions?
Sorry. One concern I have, is there something online that I can have in writing that, because I'm worried about this opening that's happening June 1st, that a lot of parents are really good, but there's going to be there's even some that fought last year when we actually had state mandates that the health care facilities aren't included, that we still want a mandatory mask wearing in the office setting for clinics, versus hospitals. There's something out there that I just haven't looked yet, but is there something out there that's clear that the public can see that we are excluded from that we can require it?
Yeah, so it is actually on the CDC website. There are some really great visuals as well as some written recommendations at this point in time that shows, unvaccinated versus vaccinated, where they can go, what they should be able to do. And healthcare facilities are highlighted as a place that masks should still be worn. So you should be able to get some really good information from the CDC website.
Good. Okay, thanks.
Yeah. Other questions?
Yeah, feel free to unmute yourselves or write in through the chat box, please. All right, Dr. Slots, I think go ahead and continue on.
Super. So let me just pull up our second talk today. And so this is really about epidemics and pandemics, and kind of talking about the difference and where we are and kind of what we are expecting. And so again, no disclosures, and won't discuss anything that is unimproved or investigative in our talk today. And so really just understanding the difference between an epidemic and pandemic, and discuss how infection control can reduce the burden of epidemics and pandemics are our two objectives for this portion of our talk. And so an epidemic is a sudden increase in cases of disease. And then if we are talking about a pandemic, that's going to be an event in which the disease is spread across several countries and affects a large number of people. I think we hear sometimes those words get interchanged, but they are certainly different. And so if we are looking at our current situation with COVID-19, an outbreak is basically the epidemic. And so that's when there's a sudden increase in cases. So as COVID-19 was spreading through Wuhan, China, it became an epidemic. But because the disease then spread across several countries and affected large number of people, it went from being an epidemic to a pandemic. And so, one of the things is, how does this even start? How do epidemics occur? And so this occurs when an agent and a susceptible host are present in adequate numbers. And so the agent can be effectively conveyed then from the source to the susceptible host. And so more specifically, this can happen with a recent increase in virulence of the agent, a reintroduction of the agent into a setting where it has not been before, has not been in a long time, an enhanced mode of transmission so that more susceptible persons are exposed, a change in the susceptibility of the host's response to the agent, and or factors that increase host exposure or involve introduction through new portals of entry. And so one of the things, clearly the COVID-19 epidemic started as an introduction of the agent into a setting where it hasn't been before. One of the things that we are concerned with right now is that as we are seeing across the United States, vaccination for our littles are certainly down over, I think they're saying 11 million. And so we could also see this recent introduction where the setting of these viruses where the setting hasn't been for a long time. So we are primed for potential epidemics of measles and pertussis and things like that, as we are noticing our vaccination rates are lower. And so our concern is there could be epidemics within this pandemic that happens. So with the risk of pandemics, we have many challenges worldwide that increase the risk that outbreaks are going to spread rapidly. So one of that is increased risk of infectious pathogens spilling over from animals to humans. That is certainly going to increase that spread. Antimicrobial resistance is a huge concern. We have global travel and trade. It's easier now than ever to, take even a weekend getaway to a different country and spread illness. Bioterrorism, weak public health infrastructure certainly can cause a risk of pandemics. And so some common challenges during pandemics really include ineffective distribution of vaccines, problems reaching providers and key parties. So we are a perfect example, and one of the reasons why we really wanted to share Project Firstline is we're a large state and have a lot of remote regions. And so we want to make sure that everybody, schools and hospitals and providers and pharmacies are all on the same page. There are certainly frustrations in areas where patients have greater health disparities. Underuse of immunization registries can cause a problem because we don't know who's gotten what when. Lack of pediatrician involvement in pandemic planning has really come forward in the COVID-19 pandemic because there's not a great relationship between pediatricians and public health departments. There's inadequate staffs and facilities to really meet the demands that come with pandemics. And again, that single source of communication, there may be poor media relationships, that outreach is just not necessarily there. And so how can we really stop pandemics from spreading? And so one is really building a public health system that works hand in hand with the states, the districts, the schools that contain public health threats. So surveillance systems are important to rapidly detect and report cases. We need to make sure laboratory networks can accurately identify the cause of illness when it's being requested. Trained workforce to identify, track, and contain any outbreaks that happen, and making sure that we have a strong emergency management system to coordinate an effective response. And so you may say, like, how does infection control really play a role in this? And so it's critical to protect people from infectious disease. So if we can prevent exposures, then as we are continuing to give out vaccines and develop specific treatments, then we are able to, stop this in its tracks. And again, those components really build on the next. So same as we talked about before: source control, visitor exclusion, screening and triage, environmental and hand hygiene, and proper use of PPE. And so, again, we have concerns for epidemics coming forward, but there's certainly that risk for future pandemics to happen. And so what AAP chapters can do now to improve pediatric preparedness for future pandemics. And so one is to create a chapter committee on pandemic and disaster readiness. We currently do not have a chapter committee or a chapter champion for this readiness. So if you are interested, we would love to talk more about that with you. You can go to our website, or you can contact our executive director, Leanne McAllister, if you are interested in doing more with a chapter committee surrounding disaster readiness. I think we've done a really good job of developing relationship with our state and local public health departments and emergency response planners. We worked a lot through the children's hospitals, both in Reno and Nevada, as well as through the AAP, partnering with public health leaders, with the school systems, trying to make sure we had a good plan in place. We also kind of want to, if you are not in a region with the Children's Hospital, making sure you're reaching out and partnering with them or your community hospital to improve emergency and disaster readiness. We really have a great statewide vaccine registry, but it struggles with if you're on the border of a different state, which I think most of our communities tend to do. And so you have people coming from a different state with their vaccine registry. So making sure that you have accurate information from your patients, as well as potentially access to neighboring states' vaccine registries. Making sure that you have a good network as a single contact. That can always be the Nevada chapter, and we do our best to make sure that we are sharing the most up-to-date information that is accurate. Maintaining proactive relationships with the media. So news networks, radio networks are always asking for people to come out and talk about what's going on, answer questions. We're getting a lot of questions right now about the Pfizer vaccine for 12 to 15-year-olds. So if you have that good relationship with the media and you feel comfortable kind of going forward with that and sharing some good information with your communities, that's really going to help. If you'd like some additional training, we do have media training through the Nevada chapter of the AAP, and you can again reach out to Leanne McAllister to get that set up. Connect with state volunteer agencies such as the Medical Reserve Corps, and then collaborate with your state Department of Education and local schools to make sure that they have a plan in place and that you're part of that. And always you can participate in any local public health meeting. So lots of areas where we can look at for future pandemic involvement. So again, an epidemic is a sudden increase in cases of a disease. A pandemic is an event in which these diseases spread across countries and affect a large number of people. And with rigorous infection control, it's crucial for protecting the healthcare workforce from future pandemics. And we really, really need to be planning for future emergencies, which is just going to be essential in our future. So we still have all of those same resources. And again, if you want to be involved in our state's AAP preparedness, then please reach out. We'd be happy to have you join us. Again, happy to take any questions or concerns. Leanne has also linked in the chat her email, her cell phone, as well as the link to get involved at the nevadaaap.org website.
All righty, thank you very much, Dr. Slots. Yeah, as she mentioned, Leanne has shared her information. Leanne, I want to open it up to you. Do you have anything you'd like to add or share with us?
Thanks so much for everyone meeting today. I can tell you that going forward, the American Academy of Pediatrics is going to continue to work with the CDC's Project Firstline. It really, we know physicians know these things, but it's a tool to help you then train your staff, train the people around you, maybe even extend training to the parents and the extended caregivers for the patients in your practice. They really are designed to be approachable, fact-based, clear understandings of controlling infection spread for the entire clinic population. So this is a a relatively new relationship. It's a new program from the CDC, but the American Academy of Pediatrics is going to continue the relationship. I'm going to put one more link in the chat here. I'd like the question about talking to parents about why having a mask in the clinic is important. Early in the pandemic, the American Academy of Pediatrics came out with these mask mythbusters. So things to make parents feel more comfortable about putting the mask on their child and why it was safe. And there's already been talk at the Academy of not necessarily a handout, but these kind of infographics that explain to the general public of, yeah, no, you're okay and your kid's okay, but the kid coming in after you has cancer. Like there's a reason why you have to have that mask on here because this is a high risk area and we treat the medically fragile here. So I would anticipate something coming out, and I tend to share those in our updates to pediatricians as well as post them on our website. But always contact me if you're looking for any kind of helpful resources like that.
Fantastic. Thank you very much, Leanne, for sharing that with us today. All right. Yeah, open it up to the group right now. Feel free to unmute yourselves or write in through the chat if you have any questions or items you want to discuss here.
The other thing I'll say is, so the Project Firstline website does have some of the training modules, but it's the videos that they're only posting on Facebook that are the ones that I make my 17-year-old watch. Like, this is why hand washing really matters. This is why ventilation really matters. And I don't run a practice anymore, but I used to run a primary care practice. I absolutely would have made that part of my employees' annual quarterly training. Okay, you've got to watch these 6 videos and then we're going to talk about them over lunch, or they're so approachable that way and they help to spark the discussion for clinic staff.
Alrighty, well, we've got a bit of time left here, so yeah, I'll open it up to you all if you have any questions that you'd like to ask.
Dr. Slots.
Yes, ma'am.
So, down here in Douglas County School District, we started doing our Binax Now rapid antigen tests on our football players and cheerleaders. And I'm just curious, I'm really worried about the variants and how well we can detect COVID. I mean, I feel like they're very accurate for rapid antigen point of care testing, but how accurate will they be maybe for the future variants that we might see come up in the future as far as cross-detecting them from SARS-CoV-1 and 2?
So I'm not sure that I really can answer that today. I think it's definitely good to be keeping that in the back of your mind. And if certainly there is, as we start to know more about the variants, then the rapid testing may change. And certainly if you have any high clinical suspicion that somebody may have had an exposure or may be sick and your rapid testing is showing negative, but you have that high clinical suspicion, then you may want to send them for more accurate testing at a lab.
Okay, thank you.
Yeah.
Great question. Thank you very much. Other questions from the group, feel free to unmute or write it through that chat box.
Well, super. If you guys have any questions moving forward, again, Leanne and I are very active certainly at our chapter level, but do a lot with National AAP and making sure that we are up to date on going to the COVID-19 town halls, watching out for any new information that's coming out from Project Firstline. So if you guys have any questions or need any resources, please don't ever hesitate to reach out and we will do our best to make sure that you get pointed in the right direction.
And I will put one more thing in so this is the AAP's interim guidance for sports participation. I anticipate it's going to change now that kids 12 and up can be vaccinated, my guess is that it's going to say if they're able to get vaccinated, they shouldn't do sports until they are. But that was the guidance before they could get vaccinated, just so you have it.
Dr. Dalton, I see you turn on your video. Do you have a question for us?
Well, we'll see how well the phone works.
We can hear you.
There's a lot of people around here in Lincoln County that are just tired of the mask thing and tired of all this social distancing. So yeah, thanks for bringing this up, because there is quite a bit of laxity I'm noticing.
Well, tomorrow, the Nevada chapter of the AAP is doing an event with the Make-A-Wish group down here in Southern Nevada, because to me, they're the inspiration of why we take so many precautions, right? Most of us can weather colds and the flu, but it's for the medically fragile among us that we do what we do. And when you think about the kids that you're protecting, I don't mind wearing the mask.
And I do think looking at some of those links that are going to kind of show you why the masks are important. And again, the CDC has released some really nice infographics just in the last couple of days about why it's still important to wear a mask in those certain areas. So, you know, I know it's fatiguing, and it is hard to be a year out and not having done some of the fun things that are coming forward for the summer. Some people haven't seen family in over a year, and yet we still have to stay really diligent until we can get to a point where we do have herd immunity in our communities. And you know, unfortunately, as we kind of talked about, you know, we're just a short plane ride away from everywhere. And as people are coming into summer, they're going to be feeling a little bit more confident on travel. And so again, really just continuing that infection prevention is going to be so important. So, you know, washing hands, wearing masks, you know, where you can, staying distanced. And I think the vaccine is really going to help, you know, especially in the 12 to 15, getting them back to sports, back to camps potentially, and hopefully kind of getting us to a point where we can return to a little more normalcy. But you know, I would encourage you guys to look at the new infographics from the CDC, because they're really interesting and poignant, and they really do help, I think.